clinics, our pharmacies, local public health, all of those folks who made that possible has sped Minnesota along in this process to get as many people vaccinated as possible. And I feel a real sense of urgency around this. I want to be very clear, as you're hearing from the CDC, as you're hearing from folks like Dr. Osterholm, of course, Commissioner Malcolm, the variants are a concern that's out there, and it feels like a race to get folks vaccinated and tamp down the variants at the same time to reduce the impact that they will have. And so the ability of what we're able to announce today, as we stand here today, Minnesota will surpass the 70% of our seniors age 65 and above vaccinated. That's that entire universe. And this is where I want to give a thank you to Minnesotans. Our uptake, meaning people who want to and are willing to take the vaccine to protect not only their health, but public health, is incredibly high, because there are some reports out there that that show resistance to taking vaccines in some groups of folks is above 20 or 30%. At this point in time, that fast lane in our highway of seniors going is still running, and we have 70%. And I want to stress that lane remains open, and our commitment to getting to 100%, if 100% want to get this, and I encourage you to do so, you are still prioritized to get that. That lane that got all of our healthcare folks, that's still open, even though we're pretty well done. Long-term care facilities and the assisted living facilities, those are still going, but pretty well done. And then, of course, our educators who are a part of this to get back and get to that number where we have over 90% of our students doing some form of in-person learning, and that is moving up every day. So those lanes are moving incredibly quickly. We've reached that, which means we're at the point where before the Johnson & Johnson and several weeks ago, the numbers looked like we would be done the end of March, first week of April. Well, now we can accelerate, and that was our hope. So our announcement today is to speed up that. This robust ecosystem allows us to do that. We've made tremendous strides, and we'll continue to do so, but today we're going to explain that eligibility. The groups will be explained by Commissioner Malcolm. You've seen them already. Those with very serious underlying health condition, regardless of age, those 5 groups that will be put on there. And then, of course, our food processing sector that is unique in that it contains a high number of folks in BIPOC communities that have been underserved or in multi-generational homes. And it's an absolute linchpin to both our economy and food security for not just Minnesota, but for the country. So those will come on board. And then I think as we're seeing this, as these lanes are going, it makes sense that that universe of folks to be vaccinated is relatively small, somewhere around 80,000. We'll be announcing a much larger group will start to get in line now too, and that's that basically 1.1 million Minnesotans age 45 to 64 with 2 underlying health conditions, one underlying health condition, and then those younger than that with 2 underlying health conditions, and then some of the sectors you'll hear Commissioner Grove talk about. This is good news, Minnesota. There is still a much higher demand than there is a supply, but the supply is increasing every week. We've seen a little lull in the J&J this week because they didn't have a lot on hand, but that is ramping up. Our anticipation from the federal government, again, and we conservatively, what they tell us 3 weeks out, puts us in a position to start moving quickly through this very large group. And just to be clear, Commissioner Malcolm probably has the more data on this. This will get us basically above 99+% of the folks who have serious illness from this who are hospitalized in this group. Now, this one's going to take some weeks, obviously, to get through because, again, it's, as I said, above 1 million people. But the pace and the ability to move these vaccines, basically 90% of them within 72 hours of when they hit Minnesota, and the vast network of where you can get these should really increase that. So, the connector is still your site. Sign up. And those of you who are saying, and I have in-laws and things telling me that, they've been vaccinated, but they're getting notified by their local clinic or their local pharmacy that they have vaccines available, that shows the system is working. There's redundancies built into this. It's making sure no one falls through the cracks. And it's making sure now that we're starting to hear that our providers are reaching down further and further into the groups. And what we don't want to have happen is we don't want to not get this thing going and start from a full stop. We want to make sure we're merging onto that freeway of lanes, that we continue to ramp those up so that we don't have folks setting on vaccines. But I want to be very clear. To seniors yet unvaccinated, you are still the top priority in the availability, and your providers and your pharmacy and the state sites are still available to you. Those educators who want the vaccine and haven't yet got it, you're still the priority. So when you go into these lanes, nothing changes for you. In terms of how we prioritize you, but it allows some of the flexibility, and the commissioner will talk about this, for providers and others to reach down to make sure we're not sitting and waiting. So this is exciting, and for those of you, and Commissioner can talk more about this, I have to tell you, I was watching the CDC, Dr. Walz's presentation yesterday about some of the changes, and I don't think I've ever been so happy to see the 2 green dot thing and then the other dots and then show that happy family group together. I called my mom today, who she has just received her 2nd shot, and this will be her first opportunity. We're planning maybe Easter, somewhere in there, where now those family members and those grandparents who are vaccinated can gather with their grandchildren in the social setting without masking, is what the CDC put out. So to Minnesotans, it's finally here. We are really on the cusp of this thing. Jan, I know Commissioner Malcolm will do this and others will do it, but I have to stress, now's not the time to let down our guard on the basic things. Keep the masks on, keep social distance, start planning, and I think it's appropriate that you're going to be able to do an awful lot of stuff come this summer, and we'll start putting out more guidance. Commissioner Grove will talk a little bit about that, but this is a good day, Minnesotans. We're ready now to expand to the next group of folks. The new lane is added to the highway, and it's going to mean a whole lot of you out there are now going to, hopefully on the connector. If you're not already there, get on right now. It's not a lottery, and it's not the first come, first serve. It's a way to connect you to this vast ecosystem of where vaccines are available and get you in as quickly as possible so you too can start visiting, start gathering again, and basically start doing the things that we've so missed over the last year.